Hi, I'm Dr. Elizabeth Coyne. I'm just going to give you a quick introduction to Module 1. Now, as you go through the completion of this module, I want you to really think about the development of the advanced practitioner in your clinical area. This really relates to both Assessment 1, but also helps you with Assessment 2 as well. So we look at how this has changed. The advanced practitioner started as an American model and is now in Australia. We also had this development between, advanced practice nurses, nurse practitioners, and also these now more clinical, clinical practitioners, which have really started to follow with nurse-led clinics, also telehealth, where there's advanced practice nurses work in these roles. We're looking at the domains of practice, and so really being aware of how this fits in the role of the advanced practice nurse, and so clinical education, research and leadership. And there's activities within the module to help you understand and share with your colleagues in relation to these changes of scope of practice and also these roles. In relation to scope of practice, there's a real sense of how theories and models of care underpin this scope of practice. And so thinking about patient and family-centered models of care, of self-empowerment, and how you as a clinician work in these models of care and how that becomes an advanced practice role. We're also looking at how the advanced practice nurse actually starts to change practice and implement change within their clinical area, but also how you measure that change and how that has been measured in the past. And this really helps you set you up for Assessment 2 and 3. So as you go through completing this module, read over the topic and Assessment 1, so you make sure you really understand how this links. Organise your time. The module should take about 50 hours. So you've got 4 topics, about 10 hours each to read over, listen to the recordings, and then Assessment 1 is linked to this module. And so really this builds your understanding of the advanced practice nurse's development and role. And helps you then work through Assessment 1, but also the information also for Assessment 2 and 3. So the key concepts for Module 1 is looking at the development, but also the working in a scope of practice, and linking the theory to these roles and how to implement this role within your clinical area. Thank you.